Good afternoon, everyone. My name is Deborah Hodges, and I'm with the Institute of Medicine of Chicago. Welcome to today's webinar with a meeting Sendy Soto from the mayor's office. She's the new Chief Homelessness Officer. We're very excited to have her with us today. Today's session addresses the homelessness and the unsheltered in Chicago in the city's 5-year plan, and to learn more about this new role with the mayor's office. So we're very excited to have you with us today. As you know, this issue is very important and a major issue in Chicago. In addition to a large city such as ours, this particular issue is critical, and it also impacts other cities, small cities, who are struggling with very similar challenges. And as thoughtful, intentional people in Chicago and in IOMC, we are concerned about their welfare, the present situation, what is the plan to assist the individuals and the families, and also the social impact that it has on our community. To bring a quote to you that I think is very appropriate for today's webinar from Ta-Nehisi Coates, you must already remember that the sociology, the history, the economics, the graphs, the charts, the regressions all land with great violence upon our body. And this is from an American author and journalist who is a correspondent with The Atlantic, who focused on cultural and social issues, if you're not familiar with it. I do want to give credit to where I saw this quote, and that is from a Chicago reader called The Community Health Equity book by 4 well-known authors and healthcare and public health professionals from the Chicago area: Dr. Fernando de Mayo, Dr. Ross Shaw, Dr. John Mazzio, and Dr. David Ansell. IOMC's mission and its efforts include the homeless and the unsheltered, and they focus on advancing health equity. So looking at these numbers that we see on this slide here, these are from some other organizations who have done some additional research, great research, in regards to their care as far as the homeless and the unsheltered. The Chicago Public Schools have identified 17,700 students as homeless in 2022 and 2023, and that number has risen to just over 24,000 as early as the beginning of this year. In August 2023, the Chicago Coalition to End Homelessness released its annual homeless estimate report, and that estimated a little over 68,000 people were experiencing homelessness in Chicago in 2021. And this reflects a nearly 3,000 person increase from the previous year. Bring Home Chicago advocates that there's about 68,000 homeless in Chicago. Whatever the numbers, because they're different from one organization to the other, they are about people, and these people are our neighbors in our community in Chicago. The World Health Organization Commission on Social Determinants of Health concluded that reducing health inequities is an ethical imperative, and homelessness is a concern for all. And this is an important step that our mayor in Chicago has created a new role, the Chief Homelessness Officer, and we're so pleased to have Sendy Soto with us today. So before we begin our presentation, I just want to give you a little bit of information about IOMC, especially if you're with us for the very first time. The Institute of Medicine is an independent, nonprofit organization of distinguished leaders in the health field, and they collaborate to improve the health of the public. The organization is about to celebrate its 110th year. They have quite a legacy of superior and excellent initiatives that they have completed over the years with other organizations as a whole. And to give you an idea of some of those past projects and accomplishments, they developed the first public ambulance service in Chicago in 1945. They fostered collaboration of hiring Black physicians in Chicago hospitals. They advocated for developing a medical examiner office instead of a coroner only. They promoted fair housing and homes for the homeless and unsheltered as far back as 1930. They established the African American Commission to improve access to care in the African American communities, and many other initiatives. IOMC is a 501c3 nonprofit organization. Today's programming in general covers 6 main initiatives, and it does include homelessness, maternal health, child health, pathways to lead, behavioral health, and nursing home reform, and also youth placement crisis. So as you can see, there's quite a legacy and also a large programmatic focus for the organization as a whole. So today's agenda, we're welcoming everyone. We're going to tell you a little bit about our upcoming programs for the remainder of the year. Ms. Soto will give us a presentation on the 5-year plan and other key items in regards to her leadership over the next few years. We will have a fireside talk with Sendy in regards to what's going on in her office. Then we'll open it up for questions and answers, and then obviously a closing, and thank everyone for their participation today. So today's learning objectives that we hope that you will take away from this program itself is that we hope that you will learn about the progress since April 2024, when Sendy was appointed by the Mayor Johnson in this prestigious role and helping the homeless and the unsheltered. So it's a relatively new office and program itself, where you'll learn about the current efforts for the homeless and the unsheltered. Briefly discuss the 5-year plan, the vision, the defined goals and challenges, and also partnerships with other agencies and groups across the city and county. But before we get to that, I just want to share with you a couple programs that are coming up. On October 29th, our next webinar, we will have the topic that will be covered is Critical Foundations in Healthcare Artificial Intelligence. And that'll be with Dr. Fernando DeMaio and Christopher Curry, both from the American Medical Association. And all of these programs are open to everyone. You do not need to be a member of IOMC in order to attend them. Another program that will be coming up on November 12th is a program with Dr. Kaleem Malik, and he's going to discuss global health and the challenges and a call to action to all of us to advance health equity. So it's a very important topic. Dr. Malik is a fellow of IOMC. He's on the board of directors. He's also on many prestigious other organizations and is largely involved with Humanity First USA and the CEO of TriLab Health. And then our final program of 2024 is going to be our 2024 Leadership Summit. The topic is The Election is Over. What does it mean for healthcare and public health? With whoever is in the White House, whatever is going to take place, it's going to impact healthcare, public health, and our community. So we have identified 4 key speakers who are going to be part of that program. And this is a biannual program. It alternates with our State of Health, the Chicago program. And so each speaker will cover specific areas that they feel are important once the election is over, and how all of us can look to see how we're going to navigate and address those concerns, for the next few years. We want to make sure that we mention and recognize and express our extreme gratitude to our sponsors who support IOMC and our mission overall. That's Golden Square, Midwest Business Group on Health, Washington Square Health Foundation, the University of Chicago Medicine, Cook County Health, Rosalind Franklin University and Chicago Medical School, the Portis Foundation, Michael Reese Research and Education Foundation, and Benish Healthcare. And joining us today also is a board member, Nellie Vasquez Rowland. She's the president-elect of IOMC, and she will be interviewing along with myself, Ms. Soto, during the fireside chat session and participating. We want to bring to your attention that if possible, if your organization or you would like to donate to our Support Advancing Health Equity Initiatives, please take a snapshot here of this QR code and donate or contact us in regards to being a sponsor. So as I mentioned, Nellie will be introducing Ms. Soto. So Nellie, at this time, I'm going to turn the presentation over to you, and I know it's in good hands.
Okay, welcome everyone. It is my absolute honor to introduce Sendy Soto, the first director for homelessness for the city of Chicago. And she's been hard at work, as we know, working on a strategy and a plan that she has a team behind her, which I know within the city of Chicago, within the associations that exist throughout Chicago, and with the community that is highly concerned about one of the fastest growing issues, public health issues happening in America today. And Chicago, with the plan that Sendy Soto plans to share with us today, we hope to emerge as leaders in ending homelessness once and for all in the most impactful and comprehensive manner possible. So with that, I'd like to give the floor to Sendy Soto and allow her to share with us the plan that we can all understand and hopefully get behind and support.
Thank you. Hello, everyone. What an absolute pleasure of mine to be here. I don't share this often, but I have a real soft spot for the healthcare community. I spent some time at Amita Health doing community benefit and advocacy for them. And I really didn't realize until then that that was the missing puzzle for really addressing all of these variety of social issues. And in my case, what public policy or the public sector can do. So I'm here to kind of share a little bit about what I'm working on. I will say that as you hear about, you know, what's evolving, please think about how you can join this effort too. As I tell people, this isn't an office of one. This isn't just an office for the mayor or the city. This is really an opportunity for all of us to think really big of how we can address homelessness in the city of Chicago. We can advance this slide. This is just some background on myself, but the mayor believes strongly, and he campaigned, and he, to be honest, and I've worked with a lot of elected officials, he truly brings us to the table with this sense and vision for a better, stronger, and safer Chicago. It is not just a tagline. He has invested in community safety, in public health, with treatment, not trauma. And then, you know, now with my role, but overall his commitment around housing as well. And I'll get into how homelessness is really a continuum of housing. It's not just those who are unhoused. So as was noted, I joined the city in April of 2024. I am the first Chief Homelessness Officer for the city of Chicago. And it is really an honor for me to come back to the city. So I did spent a few years at the Department of Housing as Managing Deputy Commissioner of Community Engagement, Racial Equity, and Strategic Initiatives. And at that time, I was able to invest in our racial equity plans for the Department of Housing and delivered on the first racial equity impact assessment for the nation on the Qualified Allocation Plan, which is the largest federal source of funding for affordable housing. I also spent some time at the Chicago Community Trust. That's where I was right before coming back to the city. And at the trust, I was in charge of addressing critical needs. So looking at funding to our public health providers, our homelessness sector, and the public safety sector as well. We can advance this slide. So this is really a brief overview of what I've been involved in the last few months, aside from, you know, being part of the hiring process because I'm the one that they chose. But, you know, this has really been what was laid out for me in the initial executive order. Not quite the one system initiative, but that probably sounds very familiar to you. The state and the city had joint efforts before I came on board, and I was able to support with that effort as that was being considered for the new arrival shelter system, merging with our traditional shelter system. But the two key areas that have really come to life under my leadership has been the CHI Collaborative Interagency Task Force, which stands for Chicago Homelessness Initiative Collaborative. And it's not just another interagency task force. I get worried when I say 5-year plan and an interagency task force because it could sound like these are just standard, you know, activities that happen in government, but what really comes out of these, right? The interagency task force is the full force of government. We have CTA, we have CDPH, we have CPS, we have city colleges. And we're really thinking out loud in person, you know, brainstorming how we can synchronize our efforts and our strategies so that when we're serving somebody on the CTA with a health crisis, that we also know what happens next. Are they placed in a shelter? How are they going to get into permanent housing? Who's going to help the person find a job and, things of that nature. I just held my second meeting. We meet every other week and just very excited for this work. One issue that we've been talking about quite frequently lately has been the encampments and just everything that goes into the encampments, right? How do we support individuals living at these encampments with the number of different needs that they have? And also, how do we ensure the community can embrace this population in a way that also, just shines the light of the issue of the lack of affordable housing that exists across the country. And the one area and one that I'm very excited to share with this group, and this is where I would like you to kind of think about how you can support this effort, is the 5-year plan. So one important output when I was at AMITA was that I helped to complete the community health needs assessment. And it was probably one of the most challenging but invigorating experiences for me because it was for the entire system. And it was truly a way for us to think about how is the healthcare system investing in the community. And in that time, it was the budget impasse, if you recall, from then Governor Rauner. And so there were a lot of challenges. And one of the biggest challenges was to address mental health in the community and homelessness. So as I dive into the 5-year plan for the city of Chicago, I am taking that lesson, I'm taking that experience and the lessons from the public health sector to apply it to the 5-year plan. I really want to lead with a public health approach and ensuring that this not only resonates for our homeless serving community, but also the public sector, just everyone in between. The beauty about the community health needs assessments is that it's social determinants of health or drivers, and it applies to every one of us in one way or another, if not directly, indirectly with our community, the communities that we're in, our families, our friends. So I'm really hoping that the 5-year plan could bring the entire city along to understand that this is really not only a full force of government effort, but all of us might have to shift to ensure that we are providing and applying the right lens to this body of work so that the city of Chicago could be a model city in terms of addressing homelessness in the most humane, compassionate manner. So this is just a quick snapshot. And, there was a really good overview of just the variety of different ways that people describe homelessness. But this is the point in time count, which is the one-day nationwide event in January that takes place. And, people go out to count the number of people sleeping in the streets, and then also count the number of people in shelter. And so this year, that point in time count led to clearly a very visible increase of the number of unhoused individuals. And that was predominantly driven by the new arrival community or people seeking asylum. Over the years, we had been addressing this, the rates had been going down, but also the pandemic and other issues continue to linger, and we're seeing the effects of all of that as well. I want to note here, and also the slides on the Coalition to End Homelessness numbers, and just the way that we are defining homelessness is one takeaway from the 5-year plan that I hope we can all feel very proud of, because there's what we would love to do here in the city of Chicago is set one definition of homelessness. We understand that when it comes to funding and other strategies, it probably needs to be more narrow. I might just count, school-age children, but we do need to have a shared definition so that we know who is considered homeless or living in precarious housing, and how do we provide the right resources so they don't remain unhoused or lose their housing. So this is really the way in which holistically we're looking at homelessness. It's for us, it's a matter in housing. It's a matter of addressing safety, ensuring that our businesses are thriving, that the school system have the resources that they need to ensure that children are learning. It helps with youth employment and ensure that youth are not on a pathway to homelessness, but rather really a pathway to thrive. And health, right? It's a social determinant of health. We want to make sure that we can support people who are underinsured or uninsured, and really address mental health. It has been an important component of Mayor Johnson, especially for due to his own personal experience, but also one that this administration is considering one of the most critical points, not only for the city but for the country, for us to really pivot the way we've addressed mental health. And so really excited to be part of a team that's looking at all of these different components and seeing how each of them complement each other or respond to one another. Housing for us is a human right. It impacts all communities, all types of housing, all income levels. Whether you are a homeowner facing foreclosure, we want to make sure that we have, supportive services for you. Whether you're, a family member with some young children or young adults that are looking to move out of their home, we want to make sure that there are options for, affordable housing for them. And then communities across the board in terms of ensuring that we have the housing stock and that people have an option to live where they want to live. We're not, cornering them to one part of the city or the other. One important change that has already occurred due to the advocacy efforts of this administration is looking at bonds to apply that to the built environment and not relying on TIF districts. TIFs are to be used in the area in which the TIF district is at. The bond ordinance that passed allows us to use those bond dollars across the entire city of Chicago, and over 600 million of the dollars will be used for permanent supportive housing and single room occupancy in a building, so SROs. So these are different ways where we're really trying to change the system and establish a different process that's equitable and applicable across the entire city of Chicago. And this is really where I think all of us could probably see ourselves in one way or another. This continuum was designed when I was at the Department of Housing, and when I was at DOH, I also worked on homelessness there. I brought in the framework of homelessness to DOH. Oftentimes, city agencies, could work, and I think in any case, we in any sector, departments, agencies work siloed in one way or another. In this case, for the Department of Housing, I really wanted to make sure that we understood what drives homelessness, even though that's predominantly an issue at that time that our Department of Family and Support Services was leading. And that's how the Department of Housing usually operated as well. They'll do the direct surveys, they know the population, we'll just build the structure, which, for the capacity and resources that an agency might have, that could be wise. But if we don't understand the dynamic and the journey to permanent housing, or lack thereof, then we're not really applying the right lens to how we are identifying new projects and providing funding for these projects to be erected. So we created this continuum with a wonderful consultant that joined us. And, I see this as really pivotal to my work, although the 30% or below area median income, and truly, sorry, in the previous slide, truly it's probably more, sorry, it's the continuum, just the continuum, yep. This is truly the homelessness prevention work probably is more within the 15% or below area median income. But the 30% or below is also where my work really lies. However, if I don't think about people moving into home ownership or wealth building or permanent housing that's unsubsidized, I really don't understand the big picture. And I want to make sure that I keep that end goal, that vision that everybody has for themselves intact, because as we look to move people into a permanent housing, experience situation for themselves, we need to understand what does the other side look like? Are there options? What are the opportunities, to ensure that we have the right mortgage incentives or down payments more so. And so that for me is really critical. And this is where we look at the full force of government, right? And the affordable rental housing probably being one of the biggest components to ensure that people are housed. But we hear often that people want to own homes. They want to build wealth. They want to build generational wealth. And we know that there is a very large, racial wealth gap that we also have to take into account. So all of this is working together, although my main focus in the immediacy is focusing on the 30% or below, or 50% or below for the extremely low income. So these are the two areas that have taken off. The SHI Collaborative, I mentioned how the Interagency Task Force has come together The 5-year homelessness strategic plan is in the works. We're looking at perhaps announcing and launching the application for the steering committee next week. We do have appointed members. A lot of the city agencies that need to be at the table are going to be appointed, and some partners of ours to ensure that we have diversity and equity across our strategic plan. But we will also be asking for the public to submit an application if they're interested in joining the 5-year plan steering committee. It'll be a steering committee of 30 people that are connected, living at the city of Chicago, or in the city of Chicago, and ensuring that we can support the process with 3 critical pillars. And I think that would be the next slide. I might have just a quick overview on that. The steering committee being a critical part of it, that will come together, and they will help us identify, and this is really part of that community health needs assessment, the 3 pillars that I'm considering to be really critical. It's the quantitative, qualitative, and then the landscape analysis of the city of Chicago. And so with the engagement into communities, we are looking to partner with a couple of public health organizations that can ensure that we're asking the right questions, engaging the right people, and maybe, if possible, lining up our plans, our strategy with the community health needs assessments that perhaps some health systems have already put together. I understand that some of the CHNAs are wrapping up right now, and so it might be a good time for us to make sure that the data, the findings are the same or can be shared or used in our strategic plan, so that we're, again, not only working from a definition that we can all use, but also maybe some very similar strategies and drive down, the issues that we're trying to address when we think about homelessness. The other component is the research and data analytics, and ensuring that we have a really strong body of researchers and data scientists involved in this process. And so we have some partnerships with some key organizations who are going to help take this on, but our goal is to have a lot of different parties involved in each of these pillars, just guiding the way as we look at new data, as we consider the ways in which we are going to define homelessness, right? What is going to help us understand better about where we are with how we end up defining homelessness. So whether that's, we're going to look at CPS data and the point in time and HMIS and maybe some other, systems within the healthcare system. We want to be able to do that. There's the community information exchange, CIE effort that's taking place with the city and county. So we want to make sure that we're thinking about just shared information, shared knowledge building, so that we're all driving this down. I think that is the goal, particularly of the public health space that thinks about homelessness and housing as part of the strategy that they're investing in. And throughout this process, we're going to be engaging the community. Really, it's thinking about how do we speak to people with lived experience? How do we speak to organizations that have a really wide network? How do we ensure that our philanthropic partners as well, in addition to supporting us with funding, how are they changing the way they are funding organizations? How are they looking at this issue? If housing and homelessness or public health are 3, areas that they're looking at, or an area of the 3 that they're working on, how is it that they can ensure that they are investing in what we need them to be investing in? And a lot of the times we work together, and especially here in Chicago, it is so rich in terms of the philanthropic community, not because it has a lot of money, but more so the connection, and our partnership is very strong. And with the Chicago Funders Together to End Homelessness, we probably have one of the best networks across the country in terms of city agencies, city partners coming together. I think that in other cities, people, are surprised that all of our philanthropic partners engage government, try to come up with the plans with government. So I do think that philanthropy wants to also look at this as an opportunity for them to reinvest in the city of Chicago. And then thought partnership, as we do the engagement across the city, we want to make sure that we're hearing from everyone. Ideally, there's an opportunity for every single resident of the city to let us know how we're doing when it comes to the issues of homelessness. What do they see to be most prevalent? What would they like us to address? it, it will be a little difficult to capture every resident, but if everyone is talking about it, if everybody feels like this is their plan, we also hope that it can address some of the NIMBYism or just the stigma that a lot of people who are unhoused have to face day to day. So really embracing this entire process with the entire city of Chicago is a key goal of mine. You're muted. Yep.
Yeah, I'm being a silent good partner here. So now we're going to open this up with questions, doing a little fireside chat with Sendy, both Nellie and myself. So Nellie, I'll defer to you as the senior person here, if you want to begin.
Yes, absolutely. Sendy, thank you so much for this excellent presentation. And I just kind of want to take a step back. You mentioned that there's different ways of measuring homelessness. Can you describe how the federal government or HUD point in time count arrives at a number that is about 10% of the number that the coalition comes up with?
Yes, the point or the federal definition for homelessness is the literal definition of homelessness is often what people call it, which is that the person has been unhoused entirely. So that this does not include, and this is where we are challenged by a lot of different advocate groups, is that it does not include, for instance, people leaving a prison or jail. That is not considered to be unhoused. It might not mean that it might not include some of the respite centers, the literal definition of homelessness is really how our continuum of care operates. And our continuum of care is I think there are 19 continuums of care in the state of Illinois. And I would hope that a lot of people in here have been involved with their continuum of care or heard from their COC. Ours looks at how we are working with that definition from the federal government and putting a plan forward for permanent supportive housing and rapid rehousing. PSH housing does require an eligibility criteria that is more healthcare based. Rapid rehousing tends to be an area that most people are eligible for. So it's a bit limited, and because it only counts the literal people who are literally homeless under the federal definition, it does not demonstrate or illustrate the need of unhoused people across the city. And I understand that it has to happen in order to ensure that we're driving some funds to people who are literally unhoused. And there is, of course, a very high number, unfortunately. But we don't then take into account the doubled up community. That is not also some, because they're doubled up or have a roof over their head, they're not considered unhoused. So somebody who's just couch surfing or sleeping, at a friend's home because they've been, kicked out or don't have any place to go, they're not considered unhoused under the federal definition that the COC operates. So the coalition's number includes our doubled up community. And this also has been, an area that we can use more data on. They've used, typically, they look at the HMIS system, which is also part of the COC, the coordinated entry system. And they tried to draw some conclusions from that, but we haven't had really a targeted approach to how we land on, how are we assessing the doubled up community? How many, community members are doubled up? And there tends to be quite a number of doubled up families in CPS schools. So school-aged children, there tends to be a high rate of doubled up families there. So it is a really, really important population that we need to bring into the strategies in our plans.
Okay, thank you for that context. And just for the listeners that are watching this today, in the HUD number, they say that we have about 6,294 homeless living in Chicago. According to the Coalition for the Homeless, the number is closer to about 68,000. And that was in 2021. And according to CPS numbers, we say that there's 17,000 children living in transitional housing situations. So that's a lot of different, definitions for homelessness. So ideally, what is the definition that you'd like to coalesce around and hopefully get the federal government to support, because the funding that we get is directly related to the HUD number. So can you give us an example, if you do come up with a number that we can agree on, how we can get public policy in the federal government at HUD to consider that number as the funding mechanism that we need to get the type of funding we need?
That's a good question. I've been trying to refrain from applying my version only because I really want to be creative and, apply a co-governance lens. But I have thought about how can we apply a more realistic definition to how we are addressing homelessness. And it really falls within that 30% and below area median income. If people are identifying to be 30% or below, they are at risk of being unhoused, or if they are at 15% or below, then they likely are extremely low income. And that way of looking at the issue really even resonates with our city agencies, because if we think about the city agencies, City Colleges of Chicago, the Office of Emergency Management, they all interface with people. They all help people that are within the 30% or below, 50% or below area median income. And so it does not discount the important work that they have to do for every resident of the city, no matter their income, right? And so if I say homelessness, it immediately goes to DFSS, or maybe Department of Housing, or maybe CHA, and those are all different agencies that do a different part of housing. But if I say 30% or below, it really resonates with people, and 50% or below, and it resonates across our board. So the Chicago Public Libraries, they've already been really involved in the issues in relation to homelessness, but just bringing that lens of, this is a population that we serve just as much as the Department of Family and Support Services.
And just another context for the people that may not be as intimately familiar as we are. There was about $21 million dollars in the city of Chicago dedicated to address homelessness for decades. And it really wasn't until, and at the time, the per capita cost for homes that we were allocating, that we were able to dedicate was about $3,500 per person based on the federal numbers, which is money that we needed to provide housing and food and, services, which, is pretty darn low, right? Wouldn't you agree? But now, with the pandemic, that number went up to about 58 million. What is the current number for the department for addressing homelessness right now? What is the current budget?
That's a great question, because we're in budget season right now, and actually had a very important budget meeting this morning. In terms of what we are looking at for 2025, it's not finalized just yet. What we are working with is the new arrival line item. So people that were seeking asylum or are seeking asylum in the US, and that were in our care through our new arrival shelters. That funding is merging into our traditional homeless line item. And we need to ensure that as we do the decompression, because we're seeing that the border does not have the rate that it was seeing a couple years ago of people that were entering seeking asylum, we do believe that for the most part, the crisis has passed us in that regard. But of course, we still have the issue of homelessness. So what we're hoping to do is move some of the new arrival shelters into our traditional homeless system and merge and increase a permanent increase in bed capacity for the city of Chicago. That is not necessarily, something that brings me a lot of pride, more than I know that people who are unhoused will now have a place to sleep that will be warm and dedicated to them. What we really are working towards is more affordable housing, because as shelters fill up, we need people, of course, to move into housing, and we would prefer not having so many more shelters, because it just, it continues to demonstrate that people just don't have that permanency that they need to really be able to thrive in place. But excited that we're able to add to the bed capacity of the traditional shelter system. And so that final number and what the cost means is to be determined at the moment.
Okay, I couldn't agree with you more that even before the pandemic, there was a report that came out that we were 100, I believe, don't quote me on this, but I know it was like 160,000 apartments short, for what we needed in terms of housing apartments and affordable apartments. So I'm intimately aware and still working in this area. So, thank you for the focus on that. But in the meantime, pre-pandemic, we had about 3,300 homeless beds dedicated for shelters. And we already know that that was half the number that was needed based on the current number at the time of homeless, which came, close to 6,200 at the time. We know that because of the pandemic, that number actually went down by about 10%. Because of the needs to, decompress, and many homeless shelters didn't have the ability to house people in congregate living to meet the, expectations of, of CDC, right? To have the social distancing. What is the current number right now of the shelter beds? And with this, I guess, integration of the asylum funding and the asylum seekers being connected to the local, current homeless infrastructure, which, by the way, we've spent $299 million on from the city of Chicago, which is a lot of money. I'm excited about that money, hopefully also being utilized for the domestic home situation, which is, again, more like 10 times more than what's ever been available in the past. What is the current count, and how is this convergence going to help build capacity and help streamline the process so that everyone's getting access to shelter, transitional housing, and ultimately the goal of, permanent housing, as you stated?
Yeah, thank you. That is such a critical question. It comes up often. It's still 3,200, and we are not only adding the bed capacity in shelters, we're also building more non-congregate shelters. So out of these crises actually have been some really remarkable permanent solutions that we've been needing, to your point, Nellie, for quite some time. We're going to have now more bed capacity, and we are building more non-congregate shelters, which mean maybe a little bit less beds, or could be a lot less in some cases, but it is going to involve much faster support and guidance for individuals that need to move from shelter to housing. And so the non-congregate shelter model really, demonstrated during the pandemic that it's very critical, especially for public health concerns, to be able to offer more non-congregate shelters. So we have about 5 non-congregate shelters in the pipeline that we're hoping come online all within the next year or so. And then on Monday, we'll be announcing the Haven, which is a low barrier housing shelter with the public health system in the area. And it's a motel conversion into housing. And it's a model that actually has come out of the health system in terms of using these structures for housing and applying the public health lens. In terms of the new arrival community, so the funding for, and new arrivals is really specific to the Illinois. It's not necessarily a definition in the US immigration system. They're asylum seekers, or they're undocumented, or they have a temporary visa. That's more of really the population that we're talking about. But for the purpose of the state, because that is how the executive emergency order that the governor signed reads, the new arrival system, demonstrated in a lot of ways, one, are we ready for a massive crisis? And this kind of prepares us for climate change, domestic migration. We've seen people migrate when there's like hurricanes or fires. And so, this was really a humanitarian crisis where we need to apply a different lens to it. But as it evolved and the issue continued, it really also demonstrated that the traditional system isn't quite ready for this population and all of the varying needs that they may have because of trauma that they experience in their country of origin. And oftentimes this goes to the definition of homelessness. Is how are we defining homelessness if they've been unhoused, and more so landless, they're not able to stay in their own home
Mhm.
country. How are they being considered unhoused? So I think this gives us a chance to really understand how all of our systems, if we stick to the federal definition, does that apply to this population? Does that apply to our veteran community? Does that apply to the reentry community? For me, it's somebody's in house and they happen to be undocumented, or somebody's in house and they happen to be, severely ill. But the unhoused part should never come with the condition that we are not able to serve them because of another part that is truly who they are and what makes the diversity and the humanitarian plans or opportunities that we have. So we need to look at the humanitarian efforts equitably, and we need to address the unhoused community and ensure that we're also not, perpetuating matters related to systemic harm or systemic racism.
Oh my goodness, so many things to talk about, and unfortunately we are running out of time. So I just want to ask you one more question, because things I would have loved to have covered we won't have time for include issues like treatment, funding for treatment, nutrition, workforce development, job placement, in addition to the permanent housing. The last question I want to ask you, because I think this is wonderful to hear that we are building capacity. One of the biggest challenges that I've always seen in this space and that prevented us from being able to build capacity was the idea that HUD did not have funding specifically to build transitional housing, because they had moved, oh gosh, I forgot the year that they did this, because there used to be funding, but they moved more towards a housing first model. So instead of putting people into transitional housing, the priority was to get them into permanent housing, which left no funds to really build capacity for transitional type housing. Where are we getting the funding? And walk me through how that flows from the feds to the state, to the city, and to the frontline organizations.
Yeah, I mean, funding for direct services comes in many different ways. And one way that we were hoping to really add to the direct service or the transitional housing sector is through the Bring Chicago Home ordinance that would have given us an opportunity to use those dollars to apply it to direct service, because even if we built permanent supportive housing through this bond ordinance, we still need to fund the services that are going to be part of that work. And if we don't have the services, the housing is not necessarily, to your point, going to make a difference if we don't really have a holistic transitional housing approach. Funding for transitional housing comes in many different ways, and I think that also can be defined in many different ways. There is transitional housing for the federal government. We have CDBG dollars, ESP dollars, emergency service program dollars. There are a lot of different ways in which we can apply. Home dollars also can provide some rental assistance. And so we have those dollars. We can apply it to these transitional services, or we can apply it to various ways that would help with the built environment in some cases. And we also have our corporate budget, which is the largest investment from the city, because it's directly, city funds. And in times we have dollars from our corporate budget that apply to transitional housing. So we do find the flexible housing pool, which is also a partnership with the public health space. We also help fund the Chicago Low Income Housing Trust Fund, which provides rental subsidies to people much like CHA, but you don't have to be necessarily on the waiting list, and it's landlord based, so it's not tenant based. So if landlords want to provide affordable housing to residents, they can apply to be part of the Chicago Low Income Housing Trust Fund. And we provide funding through corporate dollars and some other tax dollars as well. The recordation fee goes toward that now. So it really varies, but it is an area that can definitely use more funding. And this also means how are the staff being supported? What is the turnover for this kind of work? We don't want to lose people. We need to make sure that we can compete with the private sector, and that people can really, make a difference and see this as a full-time career for them. And so it is critical for us, to ensure that people are paid what they can get paid, and an organization can still stay whole. So we've been talking about how we can increase our support for the various nonprofits that are part of our delegate agency portfolio.
Okay, we did run out of time, so thank you so much, Sendy Soto. And I now pass on the wrap up to Deborah.
Okay, thanks, Nellie, and thanks, Cindy. So we have some questions from the chat box. So let's go over a couple of those. We don't want to miss them. We have a question from Dr. Mark Shields. He says, apparently there is a central agency that clears all applications for permanent housing. How can this be streamlined?
A central agency that works with the coordinated entry systems, that is a process that it is managed through the continuum of care and the coordinated entry system. And oftentimes the strategy is kind of stated to us by the federal government. Now, as a continuum of care board member, I just recently joined the board, and a few others from the city, my colleagues at CDPH and Department of Housing Commissioner and Dr. Ige and Commissioner Lisette Castaneda just joined. So the three of us, along with other partners from the city that have been on the board, can look at how these systems are actually evolving and still in compliance. And so we are looking at the prioritization rate. We're looking at how the community interfaces. You know, this is just a starting point for me, but it is something that will be critical in ensuring that the permanent housing that is provided through the coordinated entry system is accessible and understandable for people that need that service. There is permanent housing that doesn't, affordable housing that isn't necessarily part of the coordinated entry system. And I think that is going to be important to also bring forward so that people understand about our ARO units, our affordable requirement ordinance units that are built on site now more than off site, but you know, just how to access those units. The Chicago Low-Income Housing Trust Fund, majority of their units are not part of the coordinated entry system, and other efforts as well that might not be part of that system. But again, this demonstrates the importance of having this work be synchronized so that we're able to fully understand all of the options and can properly guide somebody that's looking for housing, you know, and ensure that their journey is not going to be faced with a lot of barriers.
Right. Okay. And I don't know if you've touched upon this just a small amount, but maybe you want to elaborate it, but that's your choice. A question we have is, that they're curious how new arrivals are identified.
Yes, so that is something that we've been talking about because new arrivals has a definition based on the governor's executive order, right? That we're being bused by the Texas governor coming from the border that needed a place to stay and were just not given any resources and did not have sponsors in the United States to be able to, you know, help them establish themselves or resettle. Now new arrivals has kind of taken many different approaches only because the crisis has kind of spread, you know, the people have moved all across the country and the new arrival community under that definition is probably coming now from California or Colorado or New York, that they might have ended there and then they realized that probably is not the space for them or didn't have the resources. Or so we are seeing new arrivals that have been in the country for, you know, a few months or so and are coming to what we call the landing zone, which is like an emergency operations center. That all is part of the decompression plan though. If again, the crisis at the border has subsided and, you know, we no longer have to ensure that the non-sponsor asylum seekers have shelter. And if they've been here and are seeking employment and have housing or have work permits, you know, that is really a way of life that many immigrant families have operated under, so that they're part of our society now. And I think that applies to many other immigrant families and individuals that have not come through the new arrival strategy that are also going to be served and have been served, but now are just part of the general population.
Okay, that's good. And I'm going to take my question and also a question I'll put here in the Q&A. Are you able to give an estimate, or do you know like how many veterans are involved in those numbers, if at all, or how many Black women and children? Any statistics, or is it just too early to tell?
So we do have the Black women and children, or, just in terms of the gaps of services based on race, gender, identity. That has been analyzed in a lot of different ways, but the one report that we're leaning on right now is the state's homelessness report on Black homelessness, where they have noted that, a Black unhoused individual is 8 times more likely to have a hard time getting housing than their white counterpart. And so those numbers are numbers that we're looking at, and we're hoping that the 5-year plan will have some of the same data scientists and analysis that the Black homelessness report also had. And so we do need to analyze specifically, like, where are the gaps in terms of, racial disparities. Now, racial disparities also appear in a lot of other programs for us, right? That we may not have a lot of opportunity to change, like public housing, where we're not able to apply an undocumented family to public housing. So and those are things that we could look at and advocate for, but those are out of our control. And then the whole federal definition, if you don't fit that definition, you haven't been unhoused for a period of time, if you're just coming, from the border or whatnot, that might not be applicable either. So the numbers can vary depending on how you're looking at them, but it's for sure and without a doubt that the Black community has been underserved, marginalized, and excluded from a lot of opportunities to advance housing and stability, and have, really not been able to bring forward the other issues that are really important for them too, that can stabilize them, which is education, all of these other issues that they've been asking for. We have been underserving as government, as stakeholders. And so this administration is really honing in on that, making sure that all of our communities, particularly those that have been marginalized, get resources and are the first ones to get these resources as well. In terms of veteran homelessness, I will say that I am working with the veteran community, and we have a veterans director here in the mayor's office, and we'll be working on understanding the rate of homelessness for veterans. Now, Vision Zero, or this, how homelessness has been addressed in the veteran community, is something that we're going to look at, because there had been a lot of resources, and I still believe that there is, but because that rate has gone down, we want to make sure that we are applying those best practices to this work as well. But I'll be working very closely with the veteran community, and actually that is how Nellie and I met, when she was working at a safe haven, and I was with then Congresswoman Tammy Duckworth.
Okay, we have one more question that is in the Q&A box. Could we ask voters to choose and say, like, when they're voting, say 1% of sales tax comes from groceries and being put forth to homeless initiatives? So your thoughts on that?
Adding a tax, ordinance forward is quite a challenge, but we will be looking at any way possible where we can add funding. We need a permanent funding stream to address homelessness in the city of Chicago. We don't necessarily have that. We rely on grants from the state, the federal government, but we do need, a dedicated funding stream so that we can address the direct services, so that we can ensure that we are paying organizations and their staff what they need to get paid, so that we're also ensuring that the permanent housing leads to home ownership. So without a permanent revenue of funding, we are working with the limited resources that we have. And one example is in this merger of new arrivals with the traditional shelter system. Although we would like to keep all of the shelters that have been erected under this emergency order, the long-term cost of it is not something that the city can take on alone. So we have to make some adjustments based on funding. And that's where there's some pain points, because of course it's like you're looking at structures that might be closing. It might have dollars from, IEMA or from the feds, or that we might not be able to apply for, the traditional shelter system. So we have to work with these limitations that we've been given in order for us to really serve the homeless community. But that is why we need a dedicated revenue stream. So whoever asked that question, thank you so much. I would love to talk about a strategy even that will come out of this 5-year plan, because I do think the 5-year plan will demonstrate the need, and ideally we'll have some forecasting in terms of the funding that will be required to ensure that we are really meeting what we're trying to implement in the 5-year plan.
Before I turn it back to Nellie for 1 or 2 questions, what are some other groups that you're working with or hope to work with? Because obviously that's an important question. I mean, it's a larger group of people who need to come together. They each have areas that they excel in, you know, rather than putting the entire burden on the city itself. You know, to do. It's a burden and a privilege to help these people, but it's, you know, it's a big team effort.
Yes, the Illinois Public Health Institute is a really close partner of ours. The Inclusive Economy Lab at UChicago, very important to us as well. We work with a lot of different advocacy groups. So the Coalition to End Homelessness, a very close ally of ours. And for me, having advocates push us to do better is just part of the work. They're there, they're on the ground, they let us know where the gaps of services exist. And, you know, we need to address them, and we need to be honest with ourselves that, you know, historically we haven't done right by a lot of people that have been waiting for services from the government to reach them and to see them for who they are. And that's for me really critical, is to have advocates, people that are in the field working directly with this population or the population themselves, to be the ones to join me at the table. So in this 5-year plan, we're going to have a lot of our key partners, you know, there in some ways because they hold a certain part of the work. But we also want to have some, you know, individuals with lived expertise to help guide and advise us as we move forward.
So Nellie, I think you have 1 or 2 questions.
Yes. One of the things, since we have time, that I love that you mentioned is that you're working with kind of an interagency council, and you mentioned the CTA, city colleges. And as you know, I spent 30 years thinking about, you know, funding and needing to get it done. And as you mentioned, you know, working with the VA and starting that process with the VA with our first funding coming in 2010, you know, have you given any thought, as we are looking for dedicated funding streams, to expanding that interagency council to include federal, state, county, along with city agencies, to work together towards a common, an aligned goal that achieves, you know, our vision of ending homelessness and hopefully meeting that goal of a 5-year plan?
Yeah, so the interagency council, it is, you know, part of like city government with our city agencies, where we can really dive into their budgets and their services, as anybody should, but this gives us a chance to work with each other. That I am we'll be putting together a public sector table along with the steering committee that will be part of the 5-year plan strategy, so they can see and understand what we are seeing in real time, right? Like, this is what's forthcoming. How are we planning for this? You know, is the funding that we apply, you know, to this through CDBG going to apply for this new goal that we end up deciding on? So we do hope to bring the feedback and the requests to meet the goals that will come out of the implementation plan to the public sector in all the levels of government. HUD being such a critical partner of ours, the state IDHS office, but also IDA, the governor's office, of course. And the beauty about the region, aside from having a really strong philanthropic community, we also have a strong, you know, government community or public sector community. I was gonna say progressive community, but that, you know, not necessarily always the same definition across the board, but we are pretty connected. We work with the county, we work with the state. Our older folks are close to us, and we engage them pretty regularly. And so we hope to continue to build on those partners. And as we redirect our dollars, envision something different, we hope that the same applies to all of them as well.
Finally, what is your ultimate vision, and how are you going to measure success? And are you inviting any university to kind of track, you know, our efforts along the way, so we're kind of getting feedback on a regular basis in a way that you can hopefully publicize it, and you know, again, make sure we're on the right track and supporting, you know, the goals of return on impact and return on investment, because I believe that we have to look at it from a taxpayer perspective, as well as someone who's homeless, whose time is precious, right? And they're trusting us to, as a system and a society, to get them through navigating a very tough time in their lives, whether they're coming out of prison or coming out of homelessness or coming out of addiction. And I also want you to consider looking at the 1115 waiver, which was something that got passed in 2018 originally. That could have been a dedicated funding stream. Unfortunately, we ran out of time to implement it. And in 2023, thankfully, the governor reintroduced it. And we just got, approved again as a place that there can be a dedicated source of funding. Are you familiar with that?
Yes, the 1115 waiver, which will work through the MCO, this is my understanding, which I know has that's a part of another conversation, but the 1115 waiver could be definitely an avenue for us, particularly when we think about respite care. So individuals leaving emergency departments and needing additional support and who are unhoused. So we are looking at the 1115 waiver. My understanding is that implementation won't really take off until maybe the spring or so. So we're giving the state needs to meet other demands from the federal government in order to ensure that that waiver is in full effect in the way that it's been dictated to them. But we are at the table with the state and trying to understand, what are they going to be putting forward? Can that be applied to some of our shelters? The other question that you had was about what would be success, what does success mean? That one's a little bit, there are a lot of ways to, I think, determine success. One is like the engagement. How many people have we touched with information, with resources, with a different viewpoint of how the city wants to support them and embrace them. That can be really successful if people feel like this is a safe place, a safe city that really wants to invest in them. But of course, the most tangible outcome would be that we drive down homeless individuals.
Right.
People who are living outside and in shelter, and that we are preventing people from becoming homeless. So those numbers certainly will be numbers that we'll be looking at, and we will be working with a lot of universities, U Chicago being one of them. We also work, with UIC. We'll be asking our city colleges to also come on board. They have a really great program right now, also dedicated to the unhoused students that they serve with DePaul USA. And so trying to understand, how we are navigating this space for the next 5 years and making sure that we are indeed making a very, very big dent in a positive way is going to be very important. But that final outcome and objective is to be determined as the 5-year plan and other engagement efforts continue.
Okay, looking forward to finding out more and supporting you any way we can, Sendy. Thank you so much.
Thank you.
So we've put Sendy's contact information on up now, so you're able to reach out to her. This is wonderful information, and we apologize that we're a few minutes over, but I think we could have this discussion for another hour, because there's just so many aspects in order to cover all together. So thank you, Sendy, for doing this. We hope to support you in every way that we can in your new role. This is exciting that Mayor Johnson has, and the funder has permitted this to move forward. And we hope to see a decrease in the homelessness and the unsheltered in all areas and, in all populations overall in Chicago. So just for everyone who's still here and in attendance with us, please consider sponsoring or donating to IOMC. We're an independent nonprofit organization funded by private donors and grants. We have received no government funding at all. So we rely on you in order to continue to provide programming and other initiatives overall. And I want to say thank you to all of our sponsors. Thank you very much for your assistance, your support, your kind words that you have given us over the past years and continue to do that. And then most importantly, Sendy, thank you so much for your time today. You and your office have been fantastic to work with. You have a great team of people, and it's something for us to be proud of. We appreciate it very much.
Thank you so much. And my office is office of one with a part-time assistant. So Melanie is just, so we're going to grow this office. We're going to get there. But yes, reach out to us anytime, reach out to me. And if there is anything that I can do on behalf of the mayor or that you want to get to the mayor, please consider me an ally, a friend. I really believe in being accessible, transparent, and open. And this can't be done if we're not doing this together. So thank you for the invitation. I appreciate the opportunity to get to know this wonderful organization, and I look forward to having additional events together. Thank you.
Thank you so much. We appreciate it. All right, everyone have a great weekend, the remainder of Friday, and a great and safe weekend. And we look forward to have you joining us on our October 29th program on artificial intelligence and healthcare. Take care, everyone. Thank you, Nellie.
Thank you.